In HealthWorks this morning, a really good topic. We're talking about estrogen. Is that exactly what menopausal women need, or is it a drug that could lead to a greater risk of heart disease and cancer? Dr. Mache Seibel is one of America's experts on women's wellness and menopause, and he's got a new book out to talk about the estrogen window, and he's here with us today. Thanks for being here, doctor.
Oh, it's a pleasure to be here.
Let's start with some basics. During menopause, what happens to our bodies?
Well, menopause is a transition. Much like in puberty, you transition into reproduction, and in reproduction, you transition into post-reproduction, which is menopause. So there's a lot of imbalance of hormones that ultimately settle in a new place.
So we stop making estrogen?
Production of estrogen goes way down,
okay,
and the hormone progesterone goes way down.
And how does that affect us?
Well, estrogen is impacting most every cell in the body, so it affects your brain, it affects your breast, it affects your bladder, your bones, almost all parts of your body. And
so why does our body stop making it? If we look at nature, why does it stop making it when we need it?
We have to remember that in 1900, the average age duration for a person was about 48
right,
years old. So the ability to live this long is a new phenomenon. Now, a woman lives a third of her life beyond menopause, and hormones become a very important part of that.
Let's go back. The Women's Health Initiative came out several years ago, and they did some science, apparently told us that estrogen may be linked to heart disease, may be linked to cancer. What have we learned since then? Because a lot of women all of a sudden stopped using estrogen. They were afraid.
Millions of women stopped using estrogen, and fundamentally that study got it wrong. And they got it wrong because they looked at older women, 60 to 79, and compared them to younger women, 50 to 59. But when the same women and the same data were matched by age, and women start taking hormones between 50 and 59 or within 10 years of menopause, they actually can lower their risk of breast cancer, heart disease, dementia, osteoporosis, and a whole lot more.
Okay, so that's the estrogen window that we're talking about. So why is that timing so important?
Well, while you're away from estrogen, your body is changing and aging in ways that have estrogen no longer part of the equation. So you're not preventing the plaque from coming into your arteries,
okay,
and so forth. So all of these things are going on silently.
So you need to be on top of this. How do you know when it's time to start looking for estrogen replacement?
Well, if you were the typical woman goes into menopause about age 51, but 5 to 10% of women go into menopause at 45 or younger, 1 in 100 before age 40, and the symptoms start 10 years before that. So if you start realizing that your body is somehow different, you're having foggy thinking, palpitations in your chest, sensitive bladder, it could be a symptom of what they call perimenopause, and there's so much that can be done to help you. Don't wait.
And is that a blood test, or how do you figure it out?
Well, a blood test can tell you if your hormones are in fluctuation and getting a little bit closer to menopause, so that's a good first step.
All right, there is so much to learn about this, but the important thing is that women need to know, first of all, you shouldn't be embarrassed to talk about these symptoms.
Absolutely
because some
not.
of the symptoms are very personal. Talk about them, learn about them, and understand the timing of this estrogen therapy is so important.
Become a partner in your health care so that you can advocate for yourself.
Dr. Seibel is going to be at the Jewish Book Fair, which is starting now, runs through November 13th. It's at the Jewish Community Center in West Bloomfield, and today happens to be Health Awareness Day, so you're going to be talking at 10 a.m. and I know you'll have plenty of women lining up to hear what you say, and also you'll be having your book there as well.
Yes, I will.
All right, thank you for being here.
Dana, thank you for having me.
Such an important topic. And we'll take a quick break at 8:52, and we'll be right back.